Okay, again, Bismillah, walhamdulillah, wassalatu wassalamu ala rasulillah, wa ala alihi wa sahbihi wa man wala. اللهم لا سهل إلا ما جعلته سهلا وأنت تجعل الحزن إن شئت سهلا رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقه قولي. طيب, first of all, uh, I would like to say Happy New Year for all of you. كل سنة وأنتم طيبين، وربنا إن شاء الله يجعلها سنة سعيدة علينا جميعا يا رب العالمين. Some of the colleagues, they say they cannot unmute themselves. Okay, let me just. Okay, you can unmute yourself right now, guys. Are you able?
Yes. Yeah, thank you so much.
Okay, that's good. Okay, ربنا إن شاء الله يجعلها سنة سعيدة علينا جميعا. إن شاء الله. I wish you all the best, and I wish all success for all of you guys. وأتمنى من الله سبحانه وتعالى أن يعم السلام على بلادنا السودان إن شاء الله، ويصبح أجمل وأحسن وأفضل مما كان عليه يا رب العالمين. طيب, I would like just to express my feeling for being with you after being absent for a long time. Actually, it's totally out of my control. A lot of commitments, okay, a lot of family issues, but all of things, alhamdulillah, health-wise, I'm really good. My family is good. I would like to reassure all of you. Everything is, alhamdulillah, Rabbil Alameen, under control. Some commitments, okay, some strugglings at works, but inshallah, they are going to be resolved soon, inshallah. So I have decided just to take this opportunity, just to make this open discussion meeting. I did not do it for a long time, and I'm really enjoying from time to time to do such a meeting with all my colleagues, the beginners, the advanced level colleagues, and even colleagues who passed their exams. We are still in good relationship with all of you guys, inshallah, biiznillah. It's not going to be only a relation of just courses, but it is going to be a lifelong relation, inshallah, Rabbil Alameen. Okay, this meeting, inshallah, is going to be divided into several parts. I would like to invite all of you guys. This, the final part, inshallah, is going to contain announcement of the coming soon short cases course, inshallah. And the good thing that I'm going to select 2 lucky candidates who are going to be participated in this session, inshallah, to get enrolled for free as listeners, inshallah, in the coming soon short cases course. The short cases course, inshallah, is going to contain a lot of surprises, inshallah. I'm going to mention them at the end of this session, biiznillah. I have posted a special code. I would like all of you guys, if you want to get enrolled and to get this chance, please scan the code. You are going to find it in the chat box. Are you able to find it, guys? Are you able to find the
Yes,
code?
it is clear, yeah.
Yeah. But
Okay, very good. I would like you to scan this code, okay, and enter to the WhatsApp group. By the end of the session, inshallah, I would like all of you to concentrate with me. I'm going to select 2 lucky candidates, and I'm going to ask 2 questions. The answer of these questions are going to be mentioned during the session. So your kind attention is so important to increase your luck, inshallah. And I'm going to use the Google generator in front of you for selection of the candidates, inshallah. All candidates are going to be given numbers in that WhatsApp group. All people who did not participate or did not enter that WhatsApp group will be out of the quiz. So please scan the code and get enrolled inside the WhatsApp group and wait for the end of this session, inshallah. Please concentrate, because the answer of these two questions are going to mention during our session. They might be a clinical question, might be a non-academic question. Who knows? Allah subhanahu wa ta'ala knows. So please concentrate with me. Okay, guys? Agree? Clear?
Clear.
Yes.
Okay, very good.
Sorry, Dr.
طيب.
Mohammed, the code is not clear.
Let me send the code again. Okay, here it is in the chat box. It should be clear right now. Is it? Is it clear?
Yes, clear.
Okay, very good. Okay, طيب. And another surprise, you are going to listen to some of your colleagues. They are my guests, inshallah, who attended with me previous courses, and some of them, or majority of them, have passed their exams, alhamdulillah rabbil alameen, with very good scores. By the end of the session, inshallah, you are going to meet them. You are going to listen from them to share their experience with you. So this session is going to contain a lot of surprises, inshallah. Okay, so let us get started immediately. As I have told you guys, this session is going to be a friendly session. Especially, it is going to be of good benefit for the colleagues in their initial steps in this world, the clinical exam world. Either the BASIS UK exam or the Irish clinical exam. Okay, majority of you have just finished the Part 2 exams. Very good. Congratulations for the pass. And all what is needed from you is just to relax. You need to relax. Why is this? Because preparation for the clinical exams, either the UK or the Irish exam, is really enjoyable. Why is this? Because it is going to be reflected into your clinical practice. You will notice by practice and by progression that your clinical sense is progressing. You will really enjoy it. It is a kind of a fruitful experience. It is not like a tough information like in part 1 and part 2. This exam, either the BASIS or the Irish exam, are exams of both simple knowledge and skills. There are 7 skills, and we are going to mention all of them, inshallah. I'm not going to discuss all of them in details. However, 2 or 3, I'm going to discuss them in details, and I highly advise for all of you guys, either you are going for BASIS or Irish exam, to go inside and read and understand all of these skills in details. Okay, now, as I have told all of you, you just need to relax. You just need to relax. After finishing the first part and the second part, written exams, just relax. The first thing which 100% will come to everyone at this stage is the resources. So what do you think, guys? Have you come across this struggling issue before? I need an answer from beginners. From where shall I start? Mhm.
Of course, doctor.
So what do you think? What would be the good start at this step? You are going to find a lot of resources, i.e. hard copy resources. For example, books, Rider, OST, Last Minute, etc., etc. The question is, do you need to go and start your preparation from books, Give me an answer. What do you think?
Can I answer, Dr. Mercy?
Yes, sure.
Well, after few months experience in the basis journey, I would say that I believe the right way to start with a good course, organized course to show you how to take this step.
Very good. Very good. Now, let me ask the question again, Doctor. Thank you very much, Dr. Rasha. Let me ask or rephrase the question again, guys. Do you think that books are useless?
Yes, sometimes I feel.
I disagree with you. With all respect, Dr. Kanta Khan, books are not useless at all. However, this is not the time, guys, to start reading and start studying from books. If you want to get lost, especially if you are just at the initial steps to enter this world, if you want to get lost, start from books. Books, you can start reading from them. If you want to become a tutor later on, they are so useful. They are so enjoyable. Or after getting or having an established base after a long time of preparation, if you want to explore more and more, then you can go for books. However, at the initial steps, if you want to get lost, go and start your preparation from books. You get it now, guys? Is it clear?
Yes, it's clear.
Now, so what's the solution? As mentioned by Dr. Rasha. Okay? You need to start your initial steps by attending courses. Now, to cut it short, as I have told you, if you want to get lost, start your steps by reading or depending from books. Now, we have two types of exams, the PACES UK exam and the Irish clinical exam. There are similarities and there are differences in between them. So, what are the similarities and what are the differences? But let me reassure all of you guys, because this question is one of the very common question that is going to ring and comes and goes, comes and goes, comes and goes in among all candidates. There are differences. The preparation for the Irish exam is different from the preparation of PACES clinical exam and vice versa. The answer is no. Preparation is the same for both of them. Both of them. And I know a lot of people, a lot of colleagues who are preparing for PACES exam and after finishing the PACES exam, by couple of days, couple of weeks, they enter the Irish clinical exam and they have passed. Preparation is the same for both exams with some differences. We are going to see the similarities and the differences in a while. Now, these few points, both exams contain 5 stations. These are the similarities. Both exams contain 5 stations. In both exams, you are going to face long cases, short cases, and communication cases. In both exams, 7 skills are going to be there, and your assessment is dependent upon these 7 skills, which I'm going to mention them in a while. Both of them need simple knowledge, and you need to translate this knowledge into a clinical and effective, practical, clinical, and communication manners. Let me ask you now, guys, and I need an answer from colleagues who have just finished their part 2 exams. If I ask you, give me causes of joint pains, joint pain. Now, I need an answer from you. Keep this session interactive, guys. Now, give me causes of joint pain.
Where is the joint pain? I mean,
Okay.
a small joint or a small one single joint?
Just give me causes of joint pain. I did not specify.
Okay. Okay, so if it is a small joint, I will say rheumatoid arthritis, systemic lupus erythematosus, systemic sclerosis, mixed connective tissue disorder, and also I would say that pseudo gout,
Okay.
and yeah, and if it is single joint, then I will think about pair. For example, pseudo-gout in enteropathic, and then A for ankylosing spondylitis, R for reactive arthritis, septic arthritis, and also hemarthrosis, and
Very good.
trauma.
Very good. Very good. Very good answer. All of these answers are correct. Now, the question for advanced level colleagues. What are the causes of joint pain? Again?
It's mechanical pain and inflammatory pain.
Thank you very much. You see the difference right now, guys? You see the difference? Dr. iPhone, I don't know what's your name. Who answered the question, the first question. What's your name, doctor? Our colleague who answered the question about joint pain, iPhone. Okay, anyhow, as you saw, your colleague answered and mentioned several causes of joint pain. Rheumatoid arthritis, SLE, she mentioned gout, she mentioned pseudo-gout, etc., etc., etc. However, when I asked Dr. Nisma, okay, who is an advanced level colleague, she answered by mechanical and inflammatory type of joint pains. What is the difference? The mechanical joint pain, the intensity or the character of the pain increases with
At
what?
the end of the day, after work.
Increases with movement and decreases with rest. However, it is vice versa in inflammatory type of joint pain. Okay? And each category has got its own differential diagnosis. For example, another example. All of you know, after finishing the first and the second part, that in spirometry, pulmonary function test, the FEV1 and the force vital capacity and the ratio in between them will give you the answer. Either you are going to deal with an obstructive lung disease or a restrictive lung disease. All of you know that the FEV1 in obstructive lung disease is going to be low. However, the force vital capacity is going to be either normal or low. And both of them are going to be low in restrictive lung diseases. Do you need to know all of these things, all of this information in the PACES or in the Irish clinical exam? The answer is no. All what you need to recall is the figure, the 0.7 figure. Okay? In obstructive lung disease, the figure is going to be less than 0.7. However, in restrictive lung diseases, the figure is going to be either 0.7 or more. Full stop. I will give you another example. For example, you are dealing with a case of infective endocarditis. All of you know that if you are going to start antibiotics for empiric therapy for native valve endocarditis, the guidelines say that you can use amoxicillin. For MRSA, prosthetic valve infective endocarditis, the cocktail of the antimicrobial includes vancomycin, gentamicin, and rifampicin. Do you need to know all of this information in the clinical exam? The answer is no. If you have been asked about this question in the exam, you just simply answer as I'm going to start the antibiotics according to the local antimicrobial guidelines. Full stop. As simple as that. Is it clear right now, guys?
Yes, sir.
Okay. Now, so do you have any questions so far?
No.
Okay. So these are the similarities in between these two exams. What about the differences? Differences. In PACES clinical exam, you are going to face total of 8 patients. 8 patients, 8 cases distributed as 2 long cases, 2 communication cases, and 4 short clinical cases. This is in the PACES UK exam. However, in the Irish clinical exam, you are going to face total number of 7 cases distributed as 2 long cases, 4 short clinical cases, and only 1 communication case. Each long case in both exams, please concentrate with me. Each long case in both exam lasts for 20 minutes. Each long case, either in PACES or in Irish clinical exam, lasts for 20 minutes. In these 20 minutes, you are expected to obtain history, to perform clinical examination, and to address the patient's concern and mentioning the treatment plan. Followed by 5 minutes discussion with the examiners. They might ask you about information in the history, summarize your history, summarize your clinical findings. They might ask you about the differential diagnoses. They might ask you about the plan of management in 5 minutes. This is regarding the long cases in both exams. Okay, what about short cases? Short clinical cases. All short clinical cases in both exams last for 6 minutes. Only 6 minutes. You are not allowed to take any history. You are only allowed to examine patients within 6 minutes to pick up the findings. And not only this, you are also expected to interpret all of these findings while you are performing your clinical examination in order to present your findings later on. So these 6 minutes, you will be left with the patient. Once they have done, they are followed by 4 minutes discussion with the examiners. So the whole period, the whole time for each short clinical case is 10 minutes, divided into 6 minutes with the patient, performing clinical examination, and followed by 4 minutes discussion with the examiners. They will ask you mainly about your findings, interpretation of these findings, differential diagnoses, and plan of management in 4 minutes. And before that, they will ask you to present your findings. This is regarding short clinical cases. Okay, what about communication cases? Communication cases, as I have mentioned, in the PACES UK exam, you will be having 2 communication cases in Station 1 and Station 4. While in the Irish clinical exam, you will face only 1 communication case. Okay, is there any difference in between them? The answer is yes. In the PACES exam, the UK exam, each communication case will last for total number of 10 minutes. 10 دقائق without any discussion. Examiners will be just there monitoring you watching you. Once 10 minutes are done, you are expected to leave the room to go to the next station. No discussion in the PACES clinical exam regarding communication cases. So the whole 10 minutes will be left with the patient. And this is not the case in the short communication case in the Irish exam. It is only one case. However, it lasts for only 6 minutes. Only 6 minutes with the patient, followed by 4 minutes discussion with the examiners. So this is one of the differences. If you need to keep it in mind if you are preparing while you are preparing for your exam. You need to be a little bit faster in dealing with communication cases if you are preparing for Irish clinical exam, because you are only have 6 minutes. Okay, let me pause a little bit in here, guys. In this difference regarding the communication case, do you think that having a discussion with the examiners is something good or bad? Like in the Irish exam. What do you think?
But
Somebody is saying bad. What else?
Very good.
Very good. Okay. What else? Give me your answer. Having discussion for communication cases, is it something
Maybe
good?
good, maybe bad.
What do you think?
Could be good, could be bad.
Right. Who is saying bad? I think this is Dr. Maysoon, is that right? Who said yes. Is that?
Yes, doctor. It
Why
will
do you
have
think, Dr. Maysoon, that it is a good to have discussion with the examiner in communication cases?
it helped the candidate even to pass.
What do you mean?
Yes, sometimes there is misunderstanding. I mean that the communication station at all, but when you discuss with the examiner, it will help.
Okay, very good. Very good. Having a discussion with examiners inside communication cases is a space or a room to gain marks. For example, you have done something which is not really good interpreted in the examiner's mind. So they will come immediately. Why did you do that? And by just explaining to them that I have done this because of 1, 2, 3, 4, you might gain marks. And this is not actually the case in the PACES clinical exam. The old format of the PACES clinical exam, by the way, before DIE 3 in 2023, there was a discussion following the communication case. However, they have cancelled the discussion right now. So, in order to have or to be a good communicator, you need to have a good establishment in understanding the communication principles and basics. Keep this point inside your mind while you are preparing for your exam. Okay, let me just go back to the short cases, short clinical cases. As I have told you, in the PACES UK exam, you are going to face total of 8 cases. 4 of them are short cases, i.e. 50% of the exam is short cases. While in Irish clinical exam, you are going to face total number of 7 patients. 4 of them are short clinical cases, i.e. almost 60% of the cases in the Irish clinical exam are short clinical cases. And unfortunately, most of the common pitfalls, struggling issues, and mistakes happen among the short clinical cases. In the UK clinical exam, they are fixed, by the way. One cardiology case in station 3, one neurology case in station 3, one respiratory case in station 1, and one abdominal case in station 4. They are fixed. Cardiology, respiratory, abdomen, and neuro. Fixed. However, in the Irish clinical exam, you will face 4 short clinical cases. The only fixed short clinical case is the abdominal case in station 5. So all candidates will face an abdominal case in Irish exam in station 5. Plus either a respiratory or cardiology case in station 2. Plus either a neurology or a locomotor case in station 4. Plus either an endocrine case or a miscellaneous case in station 3. So, for example, in this cycle, you might go inside and you might face an abdominal case, respiratory case, locomotor case, and endocrine case. Without having a cardiology case, without having a neurology case at all. Your colleague in the next cycle or the day after might face an endocrine case, rheumatology case, cardiology case, and abdominal case. So they are variable. The only fixed short clinical case in the Irish exam is the abdominal case. Okay, now let me tell you that, as I have mentioned, the PACES colleagues, the PACES candidates are not going to face rheumatological cases and endocrine cases as short cases. However, you might go inside a respiratory case and they might bring a patient with rheumatoid arthritis, and your task is to examine the chest of this patient with the rheumatoid hands. And you need to mention these findings while you are presenting the case. Is this point clear, guys?
Yes, clear.
Do you have any questions so far? For example, they might bring you a lady with a butterfly rash, and your task is to examine the respiratory case of this patient. And you need to mention the butterfly rash while you are presenting your case later on. Is this point clear, guys?
Yes.
Do you
Hello,
have any
doctor?
questions so far? Any questions
Yes.
so far?
Yes, doctor.
Yes, carry on, Dr. Abdul Hamid.
Yes. And miscellaneous, they are coming in a long case. Miscellaneous, like endocrine.
By the way,
Yes.
okay, thank you for mentioning this point. You know that miscellaneous cases could be any other cases. It could be a respiratory case. It could be a cardiology case. It could be a neurology case as well. No worries at all. I still remember one of my colleagues. She did her Irish exam. Okay. And she got a neurology case. She got actually a neurology case. And her miscellaneous case was a neurology case as well. So she got 2 neurology short cases. It might happen. Miscellaneous case in the Irish could be anything. could be endocrine, could be cardio, could be rheumatology, could be respiratory, could be abdomen, could be renal, could be anything. Is it clear?
Clear.
Do you have any questions so far, guys?
Yes.
Yes, please.
Yes, in this patient last case, you said about the respiratory and rheumatology. I think the time is not adequate. Is it adequate to do to validate for the B2 and auscultate for B2 and basic miracles for pulmonary? Or I have to do all respiratory examination and rheumatology?
Your task is going to be very clear. Your task is to examine the respiratory system of this patient. Full stop. You are not
I have to
required.
examine the respiratory only.
Yes. Yes.
Okay.
In the
okay.
short cases, your task is clear. Examine the respiratory case. Examine the cardiology case. Okay? Sometimes they might not be clear. Sometimes they might write examine as appropriate. And this is one of the challenges and difficulties which you are going to overcome them, inshallah, later on by attending your courses. Don't worry about this. Any questions so far?
Thank you, Doctor.
Any questions, guys? Okay. Just I need to pause a little bit to remind all the newcomers. Please scan the code in front of you in the chat box. Let me send it again if you want to get enrolled at the end of the session to the quiz, which will give you the chance to win the free slot in the coming short cases course. Let me send the, sorry. Let me send the, okay, this is the code in the chat box. Please scan the code, guys, and enter to the WhatsApp group. We are going to mention two small questions for two lucky candidates. And as I have mentioned at the beginning of my lecture, the answers are going to be mentioned during the session. So please concentrate with me. Okay, now up to this point, do you have any questions so far among the similarities and differences of the Irish and the clinical exams? Irish and the PACES exam. Are they clear so far?
Area was clear.
Okay, very good. If you remember, I told you these exams require from you two things: small knowledge and skills. And to pass these exams, you need to pass the overall score plus passing of all skills. All skills. You might get the overall score. You might exceed the overall score. However, failure in one skill will result in failure of the exam. You need to pass both the overall score and the score of each skill. These 7 skills. So what are these skills? Number 1, physical examination skill. Number 2, identifying physical signs. And please remember this skill very well. Identifying physical signs. Number 3, clinical communication skill. Number 4, differential diagnosis skill. Number 5, clinical judgment skill. Number 6, concerns, addressing patients' concerns. And the final skill is maintaining patients' welfare. Among all of these skills, guys, among all of these skills, please remember identifying physical signs, patient's concerns, and maintaining patient's welfare. I'm not going to discuss all of the 7 skills. I'm going to mention few points about these 3 important skills: identifying physical signs, patient's concerns, and maintaining patient's welfare. From the beginning, to cut it short, guys, maintaining patient's welfare. Examiners might forgive anything, if you miss something, if you did not perform this examination step properly, they might forget. They might forgive. However, 100 lines below this word, however, if you have done anything against patient's welfare, patient's safety, this is equivalent to immediate failure. And sometimes they might ask you to leave the exam. Anything interfering with patient's welfare, it means that you are not a safe doctor. Please remember, and I highly advise all of you guys, go and read the GMC guidance. GMC guidance. They are so useful about how to deal with patients. I'm going just to mention 2 lovely statements. جملتين بجد أنا بجد عجبوني جدا جدا. Number 1. The definition of patients. Definition of patients. Who are patients? Simply, who can define patients for me? Who are patients? Yalla, tell me. Define patients, guys.
Any person who has complaining from any a problem, whether organic or psychic.
Okay, thank you, Dr. Husni. What else? Who are patients, guys?
Critical patient or fault patient.
Okay, Dr. Abbas, thank you. What else?
Who
are patients?
Any person need medical or social help?
Okay, thank you, Dr. Wala.
Who is suffering without express consciousness?
Okay, thank you, Dr. Nisma. Good.
Someone has a problem, need help.
Okay, thank you, Dr. Suma. Good. All of these definitions are good. However, I really like this definition stated by GMC, General Medical Council. Patients are humans with diverse needs. Full stop. Patients are humans with diverse needs. Patients are not cases. Patients are humans. This is the first lovely statement. The second lovely statement is, it is stated that GMC expects that all doctors should advocate for their patients. If you understand only these 2 statements very well, patients are humans with diverse needs. And Allah subhanahu wa ta'ala created you as a lawyer to advocate for your patients. You are not going to do anything interfering with the patient's welfare. I hope that is clear. Very good. Now, let me go back. So, patient's welfare, as I have told you, anything interfering with patient's welfare, bye-bye, ma'as-salama, go out, no need even to complete the cycle. Bye-bye, you are not a safe doctor. You are not respecting patients. We don't want to see you in this exam. Okay? Now, what about identifying physical signs and what about managing patients' concerns? These are the most two dangerous skills that will lead to failure: identifying physical signs and managing patients' concerns. Please, please, please take care, guys. Please take care. Now, is it only this? Let me start with identifying physical signs. A lot of colleagues who went for their exams and they have pitfalls or problems in this skill in particular. Surprisingly, they notified that other skills are affected as well. In particular, clinical judgment and differential diagnosis. Why is this? Because identifying physical signs has got its own consequences. If you have done something wrong with identifying physical signs, make sure that these two skills, differential diagnosis and clinical judgment, for sure, 100% will be affected. So let me give you an example, practical example. Let's say that you went inside to examine the cardiovascular case of this patient. The real case is an aortic stenosis case. Okay? Now, you went inside and you heard a systolic murmur. Aortic stenosis will give you a systolic murmur. However, you were not so that confident and you did not interpret that murmur fully. And unfortunately, instead of coming with a diagnosis of aortic stenosis, you have mentioned the case is mitral regurgitation. And both of them will produce stenotic murmur. Is that right? Clear? Not a stenotic murmur, sorry, a systolic murmur. Is that right? The aortic stenosis will give you an ejection systolic murmur, and the mitral regurgitation will give you a pan-systolic murmur. Both of them are systolic murmurs. Are you following me, guys?
Yes, doctor.
Okay, very good. Now, you presented the case as a case of mitral regurgitation. Do you think that examiners are going to tell you, go and examine the patient again? Khalas, your time is done. But they will take you from there. You are a lovely meal to them. هيفسفسوا عليك الآن. You have mentioned something wrong. They will ask you, okay, what are the causes of mitral regurgitation? And you will start addressing and mentioning all causes of mitral regurgitation correctly. What are the, for example, differential diagnoses of mitral regurgitation? What is the plan of management of mitral regurgitation? While you are answering, you think that you have done something wrong and you have picked a proper and a correct diagnosis. However, ما بني على باطل فهو باطل. Wrong identifying physical signs leading to wrong differential diagnosis, leading to wrong clinical judgment. Bye-bye. Let me give you another example. Let us say you are required to go and examine the abdomen of this patient. While you are palpating the right side of the abdomen, you have picked up a mass on the right side. And unfortunately, you did not analyze that mass very well. And the true case was an enlarged right kidney. Enlarged right kidney. However, as a result of inability to interpret that mass very well, you have said that this is a case of hepatomegaly. examiners will start asking you about differential diagnoses of hepatomegaly, causes of hepatomegaly. How are you going to manage hepatomegaly? They might even ask you, suppose that you have detected an ascites in this patient. How are you going to manage ascites in cases of hepatomegaly? هيسرحوا بيك خالص وانت هتكون مبسوط 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 مبسوط. Thinking that you are answering correctly. Yes, you are answering correctly that questions. However, these questions that you are answering are not related to the real case. That's why identifying physical signs, bye-bye. Differential diagnosis, bye-bye. Clinical judgment, bye-bye. ما بني على باطل فهو باطل. Is it clear, guys?
Very clear.
Do you have any questions so far in regard to this skill in particular? It is the most dangerous skill. ما بني على باطل فهو باطل. In English, anything founded on falsehood is invalid. Do you have any questions in regard to this skill in particular? Any questions? Am I making myself clear for all of you now, guys?
Yes, sir.
Okay, very good. Now, coming to the second most important skill, which is managing patients' concerns. Inside both exams, you will find two types of stations where you are going to have some sort of communication with the patient in your long cases and in your communication cases. In the long cases, you are obtaining history from the patients. Patients might ask you questions later on. What is happening with me? For example, if you are dealing with an infection, is it contagious, non-contagious, doctor? Okay, blah, 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 etc. The same thing applies in communication cases. Patients will ask you questions. Patients will be concerned about a lot of things. Now, the question for all of you guys, addressing patients' concern, is it required to answer each question coming from patients? Is it necessary?
Yes, sir.
Okay, someone is saying yes. Any answers?
Yes, doctor.
Yes, sometimes
Yes.
doctor should tell about the patient concern.
Doctor should answer the patient concerns.
But
This
it
is
is
what
part of my assessment, like,
Dr. Ala.
because it is one of the exam criteria for assessment is to answer the patient concern.
Answer the patient concern. Okay. Let me ask you a question. Let me ask you a question. Answering patient's concern, is it different from addressing patient's concern or they are the same?
Yes. Yes,
Yes,
addressing the
yes.
patient concern, that means I respect his concern and I should listen to him well and I should give him answers that even if I don't know exactly what will be happening, I will say to him that I will ask my consultant and I will feed you back before you left hospital.
Thank you very much, Dr. Rasha. Exactly. Addressing patient's concern is not necessarily containing answering questions. For example, all of you know that, guys. For example, you have got a case of epilepsy, a very common communication scenario. They will bring you a patient with epilepsy and he is or she is a taxi driver. One of the advice that you need to give it to these kind of patients is to stop driving. Is that right?
Yeah.
Yes.
Okay. For how many years? For how many months? Proven epilepsy, not a first seizure. Proven epilepsy. For how many month?
Accordingly.
According to what? Let us say
According
group
to
1.
image.
He's a taxi
According to
driver.
image.
Taxi driver.
Yes.
He's a taxi driver. He's included in group
Still
1.
he will be
1
free
year,
from
1 year.
Free from
1 year.
free from attack.
1 year. Exactly. For the first seizure without establishing epilepsy, it is 6 months. All of you know this fact. Is that right?
Yes. Yes.
For example, to any reason during the exam because of stress, or the patient might ask you any question. For example, cases of pneumothorax. Doctor, can I go for scuba diving? What is the answer?
No.
No,
It is
lifelong
prohibited.
stop.
Is that right? It is lifelong unless the patient goes for decortication. Is that right?
Surgery. Surgery
Okay.
and CT.
Very good. All of you know this information. For any reason, guys, during the exam, because of the stress of the exam, you forgot these answers. And the patient asks you, doctor, the taxi driver, doctor, for how long shall I stop driving? How are you going to act? You cannot recall the answer. You don't know the answer.
I will
Yes,
ask my consultant. I will review the guideline. I will
Very
review
good.
the website.
Very good, Dr. Iman. You need.
But what I'm sure what I'm sure for it that you will stop driving now.
Before even giving the patient an information about stopping the driving, you need to deliver to the patient that you are really concerned about his concern. Your concern is really valid. This is a very important question. I highly appreciate your concern. You need to reassure the patient that you are really taking care of his concern, even if these concerns are of no value for you. They are so valuable for patients. Otherwise, they wouldn't have been mentioned or raised by them. So, if you would like to address it fully, this is a very important concern. I highly appreciate your concern. To tell you the truth, I don't know the answer, but make sure before you leave the room, before you leave the clinic, I'm going to revise the guidelines, or I'm going to ask my consultant, and I will get back to you with the answer. How does that sound with you? What do you think, guys? Have you answered the patient's concern? Have you answered the patient's concern?
No, but I
No,
addressed his
I
but
concern.
you addressed his concern fully. MashaAllah. Bravo عليك. Full mark. Even without knowing the answer. Full mark. No worries at all. No worries at all. The same patient with scuba diving. He has asked you, can I go for scuba diving? And he has got pneumothorax. You don't know. You are not sure. I'm going to ask my consultant and I will get back to you with the answer. No worries at all. Bravo. Good luck. Great job. Full mark. So there is a big difference between answering concerns and addressing concerns. You need to address the patient's concern. You are required to do so. However, you are not required to answer the whole patient's concerns. There is a big difference between addressing and answering. Is this point clear for all of you guys? And please remember, in order to reach to this level, remember that a good, and I always say this to my colleagues, a good communicator is a good listener, not a talkative patient, not a talkative doctor. A good communicator is a good listener. I hope this point is clear for all of you.
Sure.
Do you have any questions so far? Any questions? Can somebody please send the code in the chat box again, please? Send the code in the chat box for your colleagues and scan the code, please. Do you have any questions so far, guys? Any questions? Is the picture clear for all of you now regarding the similarities and differences between the PACES UK and the Irish clinical exams?
It's clear, doctor.
Clear, doctor.
Okay, now I have done, okay, and I will give you a space. If you have any questions, please ask them before going to the next part of our session, which is the guest part. My lovely guest who are going to share with you their experiences, inshallah. So, do you have any questions, guys? معقول الكلام واضح؟ ما تخافوا يا شباب، أنا ما بعبع، أسأله.
Please, doctor, I came late. This session is recorded to know the difference between UK and Irish.
Yes, it is.
Basis.
It is.
Thank you very much.
You're welcome. Okay, now before I start the part of the guest, I would like to give you the first surprise regarding the next coming short cases course, which is going to be as follows, inshallah. Let me share the screen with you. Inshallah, the next course is going to be for a short cases course, inshallah, which is going to be in March 1st, بإذن الرحمن, up to March 11 during Ramadan. So this is going to be, can you see the Zoom background, guys?
Yes,
see, doctor.
Clear.
Okay, so it's going to be a short cases course, compatible and suitable for PACES UK exam and Irish clinical exams. This course is mainly targeting cardiology, respiratory, neurology, and abdomen. Okay, what about our colleagues who are going to do the Irish exam? All of you guys, either you are going to do PACES or the Irish exam are going to be provided for free. Full recording regarding rheumatology and endocrine cases. Not only this, everyone who will be enrolled in this course is going also to have a free enrollment regarding the recorded communication course, inshallah. 2 of you guys, inshallah, are going to be lucky to get enrolled for free as listeners in this course, inshallah. So it is going to be, inshallah, starting after 2 months from now. Okay, and now this is the time for my guests to start sharing their experience with me, with us, with all of you guys, inshallah. طيب. So who is there? Our guest, Dr. Rasha.
Hello.
Yes, how are you, Dr. Rasha? Dr. Rasha is one of
Alhamdulillah Rabbil
my
Alameen, ya boss.
lovely colleagues. So if you would like, Dr. Rasha, just start sharing your experience with us and just tell your colleagues, please.
طيب ما أعرف والله. أول حاجة السلام عليكم. كيفكم إن شاء الله طيبين. أنا اشتغلت أول حاجة أنا عندي دكتوراه قبل ما أجي لدكتور مرسي، ولكن أنا طولت جدا يعني يمكن من 2017 ما دخلت التجربة بتاعت إنه أكون في إكزام ولا الستيشنز دي كلها إحنا دخلناها، لأنه أنا أول ما دكتوراه في الجهاز التنفسي ما كانت في الميديسين. جيت لدكتور مرسي دخلت له كده في الخاص في الاول ومتخوفه جدا، وقلت له والله انا يعني قريت الجزء الاول والثاني، ولكن صراحه انا افضل انه ادخل ليسنر لانه ما بعرف اي حاجه. قال لي انا والله فعلا ما بحب انسان من اول مره يدخل لي اكتف في الكورس. ده كان رايه كده، انه زول بيكنر ما بيفضل انه يدخل اكتف، لانه ما في حاجات كثيره جدا لازم الواحد يحضرها اول، الرؤيه بعد ذاك تتضح له. الحمد لله سمعت كلامه، دخلت في الاول الكورس وانا ليسنر. سبحان الله من محاسن الصدف انه تعالت لكشر ولا حاجه، في كانديديت من الناس الاكتف ما يشتغل، فقال واحد من الليسنر يدي المحاضره. صح يا دكتور مرسي؟
نعم ايوه صحيح.
يلا يعني ما تتخيلوا انه الزول لو كان ليسنر وتيحت فرصه لانه يشتغل، دكتور مرسي زول فير جدا انه يدي الناس فرصه انها تشتغل اذا عندها رغبه. لكن انا عن طريق الصدفه اشتغلتها، دي كسرت لي الحاجز لدرجه ما تتخيلوا، رغم انه انا يعني ما اشتغلت الكيس مثلا بروبر زي ما هو عاوز ولا اي شيء، لكن وانا كنت اول مره اشوف كيس تاع ضمن من سنين طويله، لكن الحمد لله رب العالمين كان كسرت لي الرهبه بتاعت انه انا ممكن اقدم بعد ذاك. استفدت جدا 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 من كورس الليسنر اكثر مما انه انا استفدت وانا اكتف. وانا اكتف كنت صح اندر ستريس، لكن لو ما كنت دخلت لكورس الليسنر اول صراحه ما كنت حستفيد. للامانه ما في زول يقول لكم اقروا من الاول اكتف وما تضيعوا زمنكم كده ابدا. كونك انت تسمع الناس بتعمل الحاجات دي، الناس اللي سبقوك، وتجي بعد ذاك راجع تشتغل اكتف، بتكون انت اشتغلت بصوره احترافيه. واصلا دكتور مرسي انا قاعد اقول لهم حاجه، قاعد اقول لهم دكتور مرسي من الكراس للراس، ما
الله
بيمر
يبارك
بمرحله
فيك يا
بتاعت
دكتور
دايجيشن
رشا
في
يا
النص.
اخي، شكرا لك يا
جيت
اخي على
له
الكلام الجميل.
من الكراس للراس على طول. يعني انت اول ما بديت معاه انا استفدت عشان حاجه تانية. جبت ورقه وقلم، تاني يوم اشتغلنا كجروب، دخلنا الكورس جروب. اول حاجه استفدنا من تجربه الجروب بصراحه، وجينا ايش شفعنا كده ونقصوا لنا فلوس نهايه الحمد لله ما قصرت دكتور مرسي. فاستفدنا من قصه جروب، يعني الناس كل ما جات في شكل جروب بتريح نفسها في انه بتقرا مع بعض. ويمكن نصكم من الحاضرين دول بيعرفوا انه انا يعني بحب شغل الجروبس يعني. فانتوا لما تجوا تدخلوا في شكل جروب، دكتور مرسي ذاته ممكن يديكم مساحه، ودكتور محمد آه حسن بيدخل معاكم وبيديكم جايد لاينز. باي ذا واي ما خلانا، والله ما خلانا. لما ما ندخل نذاكر بيقول مالكم ما ذاكرتوا، دخلنا ذاكرنا بيكون من بعيد متابعنا بيعاين لنا مالكم الليله نمتوا ما ذاكرتوا كده، لحد ما الحمد لله رب العالمين في بعض الناس مننا امتحنوا ونجحوا الحمد لله من اول مره في خلال سنه واحده بس. يعني جو من السكند بار دخلوا ليسنر، دخلوا اكتف، امتحنوا ونجحوا. يمكن احنا لانه قدمنا في كورس في امتحان جده وما اخذونا هسي، ما لقينا فرصه، ظروفنا خلتنا ما نطلع برا المملكه نمتحن. ولكن الصراحه لله، وربنا بيسالني وربنا بيسالني وربنا بيسالني، دكتور مرسي كريم ابن كرام ابن كرام.
يبارك فيك يا دكتور رشا،
كريم
ده
في علمك.
ده
لا
من حسن
والله
حسن
يا
حسن
دكتور
حسن ظنك
مرسي
والله.
يعني يمكن ما صح اشكرك قدامك، لكن كريم في علمك، كريم في حقك. ما بيطالب الناس. يعني ما انا ما لاقاني زول يقول للناس سجلوا قسطوا لي الفلوس. من وين الصيغه دي جاتك انت يا دكتور مرسي انه الناس دي حتجيب قروشك راجعه؟ فهمتوني يا شباب؟ يعني دي حاجه اللي خلتنا نحن نتعلق بدكتور مرسي ثانيه، انه ما خلانا عشان الكورس يخلص ابدا. جينا وقفنا له دكتور مرسي عاوزين زياده في الكورس لانه في ناس ما قدروا يحضروا التسجيل. قال نعم 2 ويكس اخذوها. اكشولي قعدنا شهر ما في زول يتذكرنا ولا شال مننا التسجيل.
الله يديك العافيه يا دكتور رشا،
فحقيقه
انا
يا دكتور
شاكر جدا
مرسي انت
لك
اللي
والله
عملته
العظيم.
لنا ما ما قادرين نجازيك ولا
لا
عارفين
لا
نعمل لك
لا،
شنو في
ثانك
الاصل.
يو فيري ماتش، انا ما عملت الا الواجب والله يا دكتور رشا، يديك العافيه، شكرا لك
نو
وما
اديتنا اقصى ما
قصرت
اقصى
بواجب.
ما نستطيع زمنك
لا والله،
الخاص.
دي الحاجه
والصباح
اللي ربنا
جيتنا،
سبحانه وتعالى بيسال منها الواحد، الله يديك العافيه.
انت
شكرا
اديتنا
لك يا
10
دكتور
كورسات في
رشا.
كورس واحد يا بوس.
الله
والله
يبارك
10
فيك يا
كورسات في
دكتور
الكورس.
رشا. الله يبارك فيك يا دكتور رشا، تسلم، جزاك الله كل خير. طيب I would like also to listen from دكتور غادي.
السلام عليكم، أهلا يا دكتور
عليكم
مرسي.
السلام، كيف حالك يا دكتور
أنا
غادي؟
سعيدة شديد، الحمد لله بخير. سعيدة شديد الليلة كنت معك وحضرت جزء مع إني خلصت الامتحان لكن كنت مستمتعة شديد
مبروك
صراحة.
يا دكتورة غادي، مبروك.
الله يبارك فيك، تسلمي كتير، تسلمي. تجربتي شوية بتختلف لأنه أنا دخلت من الأول أكتف، ودكتور مرسي عارف إنه أنا كنت بادية من تحت الصفر. أنا لما أخذت الكورس ما عارفة أصلا يعني ما هو البيسس، ما عارفة ولا حاجة عنه. كنت مخلصة يا دوب بارت 2، قدمت الامتحان أداء واجب لأنه أي زول قال لي I'm not sure should I speak in English
Yes, you
or
can.
everyone speak in
It is
Arabic.
better. Also, it is better.
Yeah.
Yes, it is better.
Yeah, yeah. So just to let you know about my experience, I was shocked that I got seat after my MRCP part 2, while everyone told me that it's impossible. So I got the seat on the July, and my exam was in October. I was totally lost. I saw the Dr. Morsi about the advertisement for the course, and I applied to it immediately. I was totally blank. I don't know what does even means to do the examination, or what is this short cases. I told him from day one that this is I'm a beginner, and he was welcoming. He told me no problem at all. I welcome everyone, even the beginners, and the beginners will get more advantage from the course because they start from the right beginning. I did the course. I was really doing very terrible, and Dr. Mursi knows that in my cases. But after finishing the course, I keep repeating.
Sorry for being, actually, Dr. Ghadi. Sorry for being, guys, especially those who enrolled with me before. Sometimes I usually tell you that sometimes as an examiner, I might be a rude examiner. So please, sorry for that.
No, because you put us in the vibe of the
Under
exam.
stress. Yeah.
Yes, we need to be in this stress. So I really get benefit from doing the active role play in the beginning. Although most of the people start as a listener, but I started as an active, and then I listened to the record. So my experience is different. You put me under the stress, and all the tips you give to me during my active role was really valid, and I I remember it immediately. And the cases I did it with you, it's like I save it by my heart. So I did the exam. I just to give you a background of me. I'm not working for the last 2 years. I didn't saw any patient for the last 2 years, and I started only to prepare for PACES for 3 months, or almost 2.5 months. I depend on your recorded course after I finished the active. So each video, maybe I saw it like twice or thrice. And every time I wrote a different notes. And then the notes I wrote, this is what I used for the exam, even for the long cases, because you also discussed the rheumatology and endocrinology part. I got a full mark in clinical examination, which was shock for me, because to be honest, everyone told me that you don't have any experience for the last 2 years. You didn't see any patient. You just have 2.5 months reading or studying. But I think I study smart because I started with you. And I really want to thank you very much for the valid information you give to us. Really, I didn't.
Welcome, Dr. Ghadi.
Really, I didn't need to go to read from any other sources, because you answered all the questions supposed to be asked by the examiners. And to be honest, more than the questions, because in the exam, they will only ask us like 1 or 2 questions because of the time. And
exactly.
after that, I was really surprised and happy that you keep checking on me personally, and everyone how you're doing, how's your preparation. If you need anything, please contact me. In my exam day, you send me a message, and I really appreciate all of your support. And you really give us from your time, and really thank you very much.
Thank you very
highly,
much, Dr.
highly
Ghadi.
advise your course. And I told anyone who asked me about my experience for the short cases, it's your course, definitely.
Thank you very much, Dr. Ghadi. نجاح صادف أهله. Congratulations
you
for
very
your passing the exam and having the membership. Thank you very much, Dr. Ghadi. I really appreciate this.
Thank you.
Okay, now we can also hear from Dr. Maysoon.
Yes, doctor. Very sorry for my very limited time. Today I'm in duty.
No worries.
Just I will take like 2 minutes. It is not enough to thank Dr. Mursi and to his course. I extend my thanks to Dr. Mursi, thanks to God, to my God, and then to his course. I passed the Irish fellowship exam and obtained full marks in short station. The extension course was extremely beneficial, and he is almost the only one who is offered it in short station course. For that, I give this my experience to everyone who is beginners, okay, to start with Dr. Mursi. Very thanks, Dr. Mursi, and I have in front with me Besha. Really, I take just 2 minutes.
Thank you very much, Dr. Maysoon. I really appreciate this acceptance, my
Really
invitation,
in
and
front of
sharing
my
your experience.
Yes. Thank you very much.
Thank you very much. Congratulations
Thank
also
you.
for passing the exam.
Okay, and it's the best course, really.
Thank you very much,
Thank
Dr.
you,
Maysoon.
Doctor.
Thank you very much.
Thank you.
Now, can I pass the microphone to my colleague, Dr. Muhammad Ibrahim?
السلام عليكم ورحمة الله وبركاته.
السلام ورحمة الله. Dr. Muhammad, congratulations first of all for passing your exam.
ألف شكرا لك، ألف شكر لك دكتور مرسي.
الله يبارك فيك.
Your support, your guidance. First of all, hello everyone. Happy New Year for you all. Thank you, Dr. Morsi, for your invitation to join this class with our colleagues who are preparing for Irish clinical exam or basis UK. And I hope for you all to clear the exam soon. And thank you, Dr. Morsi, for your warm words and your sincere prayers. Actually, زي ما بقولوا بالعربي يعني والله شهادتنا فيك مجروحة دكتور مرسي.
بارك الله فيك.
More than mentor. You are not only a mentor, you are the close friend for me and all our colleagues who passed the exam recently.
Thank you very much.
Thank you for guidance, for your support, for your advice. Me and my colleagues will not forget your close follow-up.
Allah يبارك فيك Dr. Muhammad.
Yeah, your follow-up before the exam, your advice to be calm, exam is easy, you can succeed. All words we cannot forget. Thank you a lot.
Allah يبارك
And
فيك
your
Dr. Muhammad.
follow-up after the exam, what happened during the exam, what's your performance, and also following us till the result appear. Thank you so much, Dr. Morsi.
Allah يبارك فيك Dr. Muhammad. Thank you very much for your nice words.
Yeah.
And again,
just
congratulations.
Thank you, Omar. Just regarding my experience, I did the Irish clinical exam Diet 3 in Bahrain, 7th of November. Actually, I was very lucky, wallahi, Dr. Morsi. I cleared the second part in March, I mean in Ramadan. You see, and the result went in March, April. At that time, I'm just asking people what to do, how many periods I need to prepare well. And I saw the groups, even Dr. Maysoon and Dr. Rasha. They told just contact Dr. Morsi for his short courses. If you are a beginner, better to be a listener. So at that time, the coming course was in June 29th up to July 20th. I joined as a listener, and I took a full package. And also, I need also to thanks Dr. Muhammad Hassan. He was also very helpful man. He arranging everything. So at that time, I took a communication recorded course, and even at that time, I didn't. That time for my exam, when to start the exam. After I joined the course, it was very helpful. Never ever I saw a course before. Wallahi, Dr. Mursi. Thank you a lot.
Thank you
a
very
lot.
much, Dr. Muhammad. Thank you, and congratulations again for your passing the exam. And I wish you all the best. كل سنة وأنت طيب.
وأنت طيب دكتور مرسي. أنت طيب.
الله يبارك فيك. Now I will pass the mic to our colleague, Dr. Mustafa. Dr. Mustafa Ramadan. Is Dr. Mustafa around? Okay. What about Dr. Umayma?
السلام عليكم.
عليكم السلام. Dr. Umayma.
يا هلا بك دكتور مرسي. Good evening all and Happy New Year.
And first of all, congratulations for passing your exam.
Thank you so much. Thank you. So guys, as my previous colleague said about Dr. Morsi, it's all true.
Yes, Dr. Mustafa will come to you after Dr. Umayma's turn, inshallah. We'll listen from you after Dr. Umayma.
Yes, I'm here.
Okay, continue, Dr. Umayma.
So as I said, what my previous colleague said about Dr. Morsi was all really the truth and right, because Dr. Morsi is really supportive personality, and he's really very good, and he's so honest and very dedicated to his course, and whatever he's doing, he's really a good person. That regarding to him, so my experience is a little bit different. I didn't know about Dr. Morsi before, so I got the seat in the exam, which I didn't imagine, and I did have about 2 months or 1 month and a half to prepare myself. But I didn't really know what to do, and like I had the second part. I got the basis exam, the MRCP UK. So I wasn't well aware about what to do and how to prepare. And because I was working, I thought the clinical part will be the easiest part for me, which I was wrong in it. So my colleague told me about Dr. Morsi, and she said it's better to join. And it was really the last day before the course started. So I joined as a listener, not by choice as the previous one, but like it was just the seat in. So I listened, and it's really my advice is the course will give you an approach, and Dr. Morsi tips will give you, either if you are an active or listener or whatever, his tips will really help you, and you will have an approach. As long as you have an approach, you won't lose your way in the exam. That's what I really benefit from him. And you need to practice, even if you are doing you are clinically active or no, you need to practice, like to listen to normal to know the abnormal, as he always used to say. And it's the first course for me, and it's like I won't recommend any other mentor or any other courses for basis or for Irish or anything. During this, in the middle of this, I had my MD exam, and he's even, like the theoretical note he used to give us in the courses, it really helped me out. Like, I'm sure I passed. I'm so grateful to God for sure, but Dr. Morsi is really, like, I can't be more grateful to him. So you will have an approach, guys, and you will learn patiently. You won't feel shy or shame or anything, and you will really get to the point and having your own approach during the exam. So from here, I want to thank you so much, Dr. Morsi, because I had the exam twice, by the way, and Dr. Morsi is really, I had the exam twice, and he was really so supportive to me, and because of him, like, I got, like, enthusiastic to get the exam again and to pass it. So like, it's the only course I would recommend, not because of Dr. Morsi and his personality only, but also because of the approach and the concept of the courses itself. You will have an approach, and you will really know what to do in the exam. As he always used to say to us, don't be surprised, just stick to your approach, and you will always win, and you will succeed this exam, inshallah.
Thank you very much, Dr. Umaima, and congratulations for passing your exams. And I wish you all the best. Thank you very much. Jazakallah kulla khair.
Thank you so much, Dr. Morsi. It was nice to be here with you today.
Thank you very much for accepting my invitation. Now we'll pass the mic to our colleague, Dr. Mustafa. Dr. Mustafa? Dr. Mustafa, are you with us? Okay, until he comes, Dr. Mustafa, I can pass the mic to Dr. Rasha. Dr. Rasha Muhammad.
Okay. Hello, everyone, and Happy New Year.
Alaikum, Dr. Muhammad.
Okay, Dr. Rasha, let us wait for a
Assalamu
little
alaikum,
bit. I
Dr.
think there
Are
is
you
a
hearing me?
connection problem with Dr. Mustafa.
Are you
Okay,
hearing
carry
me?
on, Dr. Mustafa.
Yes, I'm here. Are you hearing me?
Yes, we are with you. First of all, congratulations for passing your PACES exam, Dr. Mustafa. Dr. Mustafa, I think there is a connection problem with you. Can you hear him, guys?
No.
Okay, Dr. Mustafa, if you can fix your connection.
Are you hearing me now, Dr. Muhammad?
Yes, we can hear you now.
Yeah, okay.
Congratulations for passing your PACES exam, Dr. Mustafa.
Thank you so much, Dr. Muhammad. Actually, I'd like to say thank you so much for your help and for your continuous support. Okay, so one second. What about now? Is it okay now?
Yes, it's clear
now. Is it okay now, Dr. Muhammad?
Yes. Carry on, please.
Is it okay now? Yeah, okay, thank you.
Yes.
First of all, Happy New Year for you, Dr. Muhammad, and I wish you this new year will be with success. And also, I would like to say congratulations to all my colleagues who recently passed the part 2. And I just very sure that all of you you will pass this basis exam soon, and we will congratulate all of you guys.
Inshallah.
And first, I'd like to say that the course of Dr. Muhammad, it is very unique. He has experience in how to deal with this basis exam on the proper way, and he has a unique approach. The way that Dr. Muhammad dealing with the course, he asking you the questions exactly as the examiners asking you in the exam. So you feel that you did this exam before. Also, it is very important either for the beginners or for advanced one who preparing for PC's exam. The material for in the course, I think it is enough. No need to open any books or to search for any other sources. The course will cover everything. Any information that you want in the exam, it will be in the course. I highly recommend this course either in the short course or the communication course. I think all of you will enjoy this course, not only for the exam or for your practice. You will enjoy by the way that Dr. Morsi will deal with this course by giving your information step by step, and also he has the ability to get information from your inside, even if you don't know the answer. He has, I think, special way to take the information and to discover you from inside, even if you don't have this information. Dr. Morsi courses, I think it has helped me very much, and also Dr. Morsi. He was very supporting during the course, after the day after the course, before the exam, the day of the exam, even after your exam. He will with you all over your journey, and all of you will find this. Thank you, Dr. Morsi, for your time and for your kindness and for everything. I was lucky to attend with you this course, and actually
welcome والله دكتور مصطفى كان لي عظيم الشرف والله
course,
it was so honor يعني to be to know someone like you, and I still remember, guys. Okay, Dr. Mustafa performed Hajj last year, and he sent me a special recording dua from Arafat. Wallahi, I cannot forget this. Thank you very much, Wallahi, Dr. Mustafa. It was really, really very, very, very nice moments at that time. Thank you very much, Wallahi.
You deserve all the best, Dr. Muhammad. You deserve all the
Thank you
best.
very
And also, I
much.
cannot forget that you advised me to say special dua before the exam,
Yes.
to say
Yes.
اللهم إني تبرأت من حولي وقوتي ولجأت إلى حولك وقوتك أنت. I didn't forget this dua, and usually I'm doing this before the exam, and I think it was on the reason behind my success. So also, I advise all of you guys to be strict with Dr. Muhammad and to take his advice. So with all of his advice, you will pass the exam easily, and you will enjoy, and he will make your life easy for
بفضل الله
sure.
أولا وأخيرا. الله يبارك فيك يا دكتور مصطفى.
Thank
Thank you
you.
very much. Thank you very much. And again, congratulations
جزاك
for
الله
passing your
جزاك
exam.
الله عن كل خير.
Thank you very much.
Thank
Now
you.
we'll pass the mic to
Thank you
Dr.
so much,
Rasha.
Dr. Muhammad. Thank you so much. Thank you.
Okay, hello everyone. First, I would like to express my gratitude for Dr. Morsi to provide me with this amazing chance. I'm Dr. Rasha Muhammad, the admin of MRCP Part 1 and Part 2 group. So maybe some of candidates here included in my group. I live permanently in the UK. Very little about my background. I have done the registration in the UK, worked in different hospitals, then decided to stop for a few years for my family. I found out from my experience in my group, Part 1 and Part 2, that is the most important in MRCP journey, the emotional support more than academic support, which both you will find in with Dr. Mursi. Honestly, I'm still preparing for basis exam, but I guess I would like to talk about my experience because the mistake that I passed through, I don't want people to take it. I passed MRCP Part 2 in April 2025, and I've been advised to include in Dr. Mursi course, and I understand from the candidate around me, particularly Dr. Rasha, advised me. However, I feel like let me just try to revise more about the thing that I have weakness in before to include in the course. And I really regret it. It was the biggest mistake that I ever done. Because like after few months and after I take the course in September, I feel like that's the time I just start the basis journey. And I just waste like 5 months for nothing. So I just feel like it's better to take the course and know how to take the step with the proper way. And as I said, like from my experience with the candidate in MRCP Part 1 and Part 2, it's not just academic support. Like, يعني I'm really speechless. والله يعني الدعم اللي لقيناه من دكتور موسى. I'm so sorry for people like want me to talk in English, but there is some word we really need to say it for Dr. Morsi. يعني الدعم اللي لقيناه ما تستاهل.
You deserve this, Dr. Rasha.
So
Everyone in this journey, by the way, you have mentioned a very important point. Everyone in this journey, okay, need support. And support is not only an academic support. First of all, it's an emotional support, spiritual support, because without emotional, without spiritual support, you will not be able to understand anything at all. So it's a
yes,
cornerstone in your journey. It's very important.
Exactly, Dr. Morsi. And particularly for me, as I said, like I have worked in different more than 10 hospitals in the UK. Then I put my registration in hold. So I feel like I've been advised, okay, don't take the clinical exam now and take your time. And take my time. This means like I feel like I was very relaxed. Then I find like many months pass away already with nothing. As I said, till I start in the September, and I found okay. The most important thing that I need to tell you about the course is very organized, and even والله سبحان الله يعني أنا is not just for the basic exam. My problem in the CNS in MRCP part 1 and part 2 it being soluted in the course because I feel like okay yeah, like the way that the course and the organization make you understand even if you have problem. So don't hesitate to start. Thank you so much, everyone.
Welcome, Dr. Rasha. Thank you very much. Now I can pass the mic to Dr. Ala.
السلام عليكم يا دكتور مرسي and hi everyone.
السلام.
Happy New Year for everyone and I wish everyone
خير.
the success inshallah.
إن شاء الله.
Inshallah. So, wallahi, first of all, and I would like to say thank you very much, Dr. Mursi. Our course was really very comprehensive. Honestly, you know, you don't need to look for any other resources at all because the course is like covering everything from A to Z. And he really explains everything very clearly and very simply. As like you are a medical student, he really explained everything from A to Z. I remember when I was watching his neurology course, it really made my life very easy because I have like trauma from university about CNS system. Honestly, he made it very easy, very simple for me. And what I really also like about the course is the approach. Like, for example, in CNS or whatsoever, so he at least like discuss more than 10 or 12 cases, and each case, so you listen first of all for the case while they are doing the assessment, and then he repeat everything again from A to Z. And this is, I really found it very helpful because it has really helped me a lot to like remember the approach of examination. So if you listen to 13 patients, you will definitely memorize everything by heart because he keep explaining everything for every single case. And the other thing is like you don't need to worry so much about what is the differential diagnosis, what I need to look for in this patient, what investigation, what treatment, because he really simplified these things in a very clear way. All you need during your examination is just finding something wrong with this patient, identifying clinical signs, rather than making your mind very busy about how to investigate and or how to treat this patient. Also, I would advise everyone actually to attend his recorded course first of all, so you can understand the concept of the exam and what is required from you. Because I remember in my experience, I have just cleared MRCP2 and initially just went to an active participant, and I was shocked in day one because this exam is a different level. It is not like you are having a paper, you have to answer A, B, C, or D. No, it is a different level. So I would really advise everyone to join his recorded course so you can understand what is going on and then get yourself prepared for active participant, because the way he do the sessions is really looks like the exam pattern, and his feedback is really very, very good. It is actually very similar to the exam feedback. The other thing also, I'm actually working in the UK. Currently, I'm an IMT trainee. I did so many bedside teaching in the hospital about basis. I have also been through past test videos. And honestly, there is no any new questions or any new information because everything he covered from A to Z. Honestly, I have been through past tests. I was trying just to find a single new information and I couldn't find anything. So I would really want to thank you because you really made the short cases very, very like it's not a hectic for me right now because
Thank you very much, Dr. Ala.
I took my notes, and every time if I want to remember something or say anything, I will just find it in my notes, and that makes my life much easier than the other part of the exam.
Thank you very much, Dr. Ala, for your nice words. And inshallah, we will hear soon about passing the exam, inshallah.
Inshallah. And from this platform, Dr. Mursi, I would really want you to offer us long clinical consultation course as well, because
Inshallah.
now this is my main struggle, because I know from the short cases I have my notes, everything is clear, but I feel like I'm jumping from one book to other book because of the long clinical consultation.
Inshallah, soon, bi'Iznillah. Thank you very much, Dr. Ala.
Thank you.
And finally, I need to welcome my senior, Dr. Hafia.
Yes.
Dr. Hafia, the
hello
mic is
everyone.
yours.
Hello everyone, and wish you all the best, inshallah. I'm Dr. Hafia, طبعا senior of Dr. Mursi, as he mentioned. And my experience is a little bit different from you because I joined the course as a visitor first. I thought first that it will be just like any course. I may get some benefit, but as I am doing my MD 15 years ago, and I am practicing medicine since that time without any gaps, I thought I will not get much benefit from that. This is why I start listening. But really, from the first time I start with the cardiology course, I get astonished. Really very organized, very perfect, helpful, even for me as a practicing doctor for a long time. I get much benefit. I become more organized. Me myself, I become more organized, and really I get even new information. Really, in spite that at first I thought that I will not get much benefit. Not really, no.
Very much, Wallahi, Dr. Hafia. Thank you very much.
I'm very happy. I'm very proud to be with somebody like Dr. Mercy around him. Really, I get benefit. I even there is some improvement in my practice. Really, and this is not any. Frankly saying this in spite of everything. Thank you, Wallahi, Dr. Mercy. I hope
Thank you very much,
the
Dr.
best.
Hafia, for accepting my invitation and for your nice words. Thank you very much. I really appreciate your words, guys. And مسك الختام, as I have told all of you, I would like to thank all of you guys. Okay. And special thank to my guests, okay, for their nice words. Now, in front of all of you, I'm announcing for the coming short cases course, which is going to cover cardiology, respiratory, abdomen, and neurology, in addition to free recorded short cases for endocrine and rheumatology, in addition to free access to communication course. And my communication course contains 2 parts. The first part contains 3 introductory lectures, starting from not from level 0, but below the 0. I'm going to take all of you, assuming that you don't understand anything in communication, building up information, discussing ethical issues, discussing legal issues, discussing the basics, principles, and active parts of the effective communication. And then you are going to be moved to the second part, which are the cases. My communication recorded course does not contain too much cases. It contains around 60 cases. However, most of you who attended or who purchased the recorded communication course in particular before, understood that The value of the course is not in the quantity of the cases, however, in the quality of cases. Because at the end, the net result is being able to deal with any kind of communication case you will come across, even if you did not come across in the recorded communication course. The quality rather than the quantity. So this is the first surprise. You will get enrolled and you will get a free access to the recorded communication course, rheumatology and endocrine courses, endocrine cases for all attendees who are going to attend the next course, inshallah. This is the first thing. And the second thing, now let me just revise the WhatsApp group. Okay, the WhatsApp group. Now, the WhatsApp group contains 72 members. Okay. Now, I'm going to stop the recording after a while right now, guys. And I'm going to send you 2 questions in the WhatsApp group. Okay? 2 questions in the WhatsApp group. I'm going to send the first question and I'm going to allow 5 minutes to stop the time. And then I will send you the next question. And I'm going to give you 5 minutes to receive the answers. And I'm going to mention numbers in these answers. And I'm going to use the random Google bar, inshallah, to select 2 lucky candidates who are going to get enrolled for free for the next course, inshallah. So please bear with me right now. I'm going to send the first question right now. Okay? Because I want all of you to see the random selection of the numbers in order to avoid the bias. Okay, guys? Let me just stop the sharing right now in here. So the group content, let me just start the sharing with you in here. So can you see the background now, guys?
Yes, we can.
Yes.
Okay, so the group contains 72 patients, 72 candidates. Okay, now the first question is going to be in the group right now. And I'm going to select I'm going to give you 5 minutes, 5 minutes to collect the answers. The question is in the WhatsApp group, okay? Now, you will find the question right now. Answer it. Guys, please mention the numbers only. What is this 93, 72? I'm going to take the first figure only.
بليز دكتور ما فيش وصلش ولا أي جروب.
Have you entered the group, Dr. Husni?
أنا في جروب أيوة مكتوب دكتور.
Chat box.
Chat box.
Lucky candidates, yes.
Chat box.
Still getting the answers.
مش موجود في الشات بوكس يا دكتور. الشات بوكس على
طيب.
على الزوم.
Sorry,
Yes.
Dr. Murthy. Can you send the question again? Sorry, we just open the WhatsApp. I can't
Okay.
open.
The question says, how many guests were with us in this session? How many guests were with us in this session? This is the question. The answer is going to be accepted only in the WhatsApp group. I'm going to send you the code for the WhatsApp group. This is the code. You will find it in the chat box. Chat box of the Zoom. Scan the code, enter to the WhatsApp group, and place your answer. How many guests were with us in this session? So another 1 minute to close this question. How many guests were with us in this session? Okay, 30 seconds to close this question. Okay, time's up. Time's up for this question. No more answers after this question. So, okay. So the correct answer is 9 guests. 9 guests. So let us see. So this is the first one. 9. Okay, this is the second 9. Where is the third 9? Most of you said 8, 8, 8, 7, 8, 9. Okay, this is the third 9.
أنا بصراحة ما عرفتش أدخل في الجروب يا دكتور محمد.
Okay. Try to okay, I will send you the link in the WhatsApp. The link in the chat box. Okay, where is the link? You might be lucky in this next question, Dr. Husni. Okay, this is the link in the chat box. If you did not get enrolled, click on this. Okay, so only 3 people answered the question correctly. So 1, 2, and 3. So let us see the number generator right now. So number 1, 2, and 3. Are you with us, guys, right now? One of them is Dr. Hussein.
Yes.
Dr. Hussein, your number
Yes.
ends with 9190. And one number from Saudi Arabia, one number from Ireland. Okay, so 3. So only 3 people will have the chance to get enrolled. The first will be the first lucky one. So which one is going to be the first, the second, or the third? So now The number generator is in front of you guys to avoid the bias. Bismillah ar-Rahman ar-Rahim. Start the generate. So number 3. Number 3 is going to be the lucky one. Who is this number 3? Contact me. 2214. Who are you, doctor?
السلام عليكم دكتور عبد اللطيف.
Hello, Dr. Abdul Latif. Okay, so you are the first lucky one. Congratulations. Contact me in the private after the session, please.
Highly
Okay.
appreciate. Thank you.
Okay, so the next question, guys. Inshallah, several candidates will answer it very easily. Okay, the next question is this is the next question. How many patients are you going to face in the Irish clinical exam? Start. Okay, so 2 minutes, guys. Mhm. How many patients are you going to face in the Irish clinical exam? Okay, now still going on. Another 1 minute. Come on, carry on. So for the new joiners, how many patients are you going to face in the Irish clinical exam? I mean, how many cases? How many cases? Forget about surrogate, forget about real patients. How many cases? 15 seconds. 14, 13, 12, 11, 10, 9. Only in the WhatsApp group, guys. 5, 6, 5, 4, 3, 2, and 1. Time's up. Okay, no answer after this. Okay, so the correct answer is total of 7 cases in the Irish clinical exam and total of 8 cases in the UK clinical exam. So a lot of correct answers. So let me just rearrange them. طيب, بسم الله. So number 1, number 2. This is number 3, 4, 5, 6. Okay, let me pause the Zoom recording for a while. Okay, 6, and this is 7, 8, 9, 10, 11, 13, 14. MashaAllah. Also cases are right. 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, and 30, 31, a lot of number, a lot of colleagues, 32, 33, 34, 35, okay, this colleague has left, okay,
رقم 12 يا دكتور مرسي.
12 left.
No, I think you missed number. You
Missed a
mentioned
number,
11,
really?
then 13. You missed number 12, I think.
11, okay, طيب, I will mention it. So number 12, okay, المعارب. So I will give you here 12. Okay, then 35, then 36. Is that right? Yes, 36, 37, 38, 39, 40, 41, 42. Dr. Nisma mentioned 4 and 3 surrogates. Okay, طيب, no worries. 41, 42. طيب, 43. 44. It's really very difficult, guys. Okay. Guys, خلاص, the quiz is end. Okay, let me stop the group. Okay. So 45, 46, 47, and finally 48. So 48 cases. 48 number is 48. طيب, let us resume the recording. So 48 candidates answered the second question correctly. طيب, so let us see the generator. Can you see the generator now, guys, in front of you?
Yes.
Okay, so 1 to 48. So Bismillah wa ala barakatillah. So number 36. Who is number 36? Dr. Ma Ahmed. I don't know, but 058-183-4545, a Saudi number. Who is this?
Yes, it's me, Dr. Morsi.
Oh, can you introduce yourself?
Yeah, it's my Dr. Mahjoub.
Dr. Mahjoub. How are you, Dr. Mahjoub? Please contact me in the private. Dr. Mahjoub. So, Dr. Mahjoub, and the first one, congratulations for being enrolled for free, inshallah, as listener slots in the coming course. I would like to thank all of you guys. Okay. And if you need any questions, inshallah, I'm going to try my best, inshallah, in the next coming 2 months before starting the course. I'm going to try my best, inshallah, to conduct free sessions discussing communication, discussing short cases, and even long cases, inshallah. However, as I have told you, I have a lot of commitments, inshallah. They are going to be solved soon, inshallah. Inshallah, I will try my best. However, the course is going, inshallah, to be started on March 1st for 10 days. And don't forget, everyone who is going to get enrolled in this course is going to receive a free access to short cases of rheumatology and endocrine and a free access to recorded communication course, inshallah. Best of luck for all of you. Thanks for being with me. And if you have got any questions, please invite your colleagues, okay, to join my platforms. And I will be happy to answer all of your questions, inshallah, in order to reach to the maximum benefit and finalizing your journey by passing the exams, inshallah, soon. Do you have any questions?
Yes, doctor, I have a question, if you don't mind.
Yes, please.
Regarding the course, it should be a live course, I mean physical attendance, because my problem is I want to know how to pick signs, which you have just mentioned, how to differentiate between renal mass and hepatomegaly.
This is,
So it
yes,
must
Dr.
be.
Husni. This is a mandatory requirement. By the way, I always say to all my colleagues, attending the virtual short cases course is not enough unless you are going to translate all what you are going to learn into a practical manner. There is no excuse not to see patients. There is no excuse not to touch patients. There is no excuse at all not to pick up the findings by yourself. However, going and seeing patients, picking up findings, or attending live courses after attending the virtual short cases course will ease your life. And you have listened to the experience of your colleagues. It is going to ease your life because you are not going to be required to open any books. All questions, all signs, or differential diagnoses, or plan of management, all expected examiner's questions will be included in that course. I hope that's clear for all of you guys.
Assalamu alaikum, Dr. Mercy. Can you hear me?
Yes, please.
Thank you, Dr.
You're welcome.
Sir,
Yes,
I'm
carry on,
Dr.
Dr.
Harith.
Harris.
I'm from Pakistan, sir. So thank you so very much for this great session today.
Welcome, Dr. Harris.
Cleared a lot of concepts about the PACES exam. I just passed my Part 2 exam, so planning for Diet 2.
Congratulations.
Sir, would this course be? Thank you so much, sir. So would this course be beneficial for ones appearing in Lahore, Pindi, or Karachi Center as well? So, or it is specific for the Arabic countries, because our language will be definitely English going forward if we are getting enrolled to the course. And secondly,
Yes.
sir, can you please also guide about the fee structure of the course as well? So it would be pretty much.
Yes, thank you very much, Dr. Harris. Concerning the first question, the whole course is going to be conducted in English. So going to be conducted in Arabic. Okay, and even any single word in Arabic will be immediately translated into English. Don't worry about this. This is number one. Number two, it is going to fit the whole sentence, inshallah. As you see, different experience from different people. They had their exams in UK, in Ireland, in different Arab countries. And all of them, Alhamdulillah Rabbil Alameen, passed their exams with full scores. Regarding the second concern, okay, you can just contact me. I will give you the contact number of the, inshallah, the coordinator, Dr. Muhammad Hassan, who will give you more and more details about the structure, about the fees, about everything, inshallah.
Thank you. Thank you, sir.
You are welcome. Any questions, guys, before I leave?
Victor,
Yes, please.
anything we can do from now until March, until the course, to be more prepared? And thank you for everything, Victor.
You are welcome. Okay, a lot of things can be done. Okay, just contact me in my private. I will give you a lot of advice, inshallah.
Okay, thank you, Victor.
Inshallah. Thank you very much, guys, for attending this session, inshallah. And as I have promised you, I will try my best, inshallah, to conduct free sessions. However, I would like just all of you to pardon me if I'm being away because of several commitments, but I will try my best, inshallah. For the course, we are going to meet you, inshallah, in March 1st for 10 days. It is going to be a very beneficial one. Thank you very much and see you soon, inshallah. في أمان الله. جزاكم الله كل خير.